Hi, I'm Fiona Myers. I'm one of the cardiologists here at Veterinary Specialist Services. This is Rocco, who's come in today for a cardiology exam. Rocco's come from Gladstone, haven't you? Hey? And here at the Cardiology Service at VSS, there are 3 cardiologists, myself, Dr. Brad Gavigan, and Dr. Christopher Lamb. And we're very fortunate to work here at VSS because we have this multidisciplinary approach where our patients who have multiple comorbidities and critical care patients who may have cardiac concerns, that we can all receive the excellent care under the same facility. If you come to Veterinary Specialist Services to see a cardiologist, often that's a very stressful time for pet owners because pet owners have been given information from their regular vet that their pet may have a heart problem, and so we're very, very aware of the stress that involves. And if there's ever concern about the urgency to see a cardiologist sooner than your scheduled appointment, we're always very, very keen to prioritise communication with your regular veterinarian, review of medical histories to make sure that a patient is prioritised based on their concerns. When a patient comes in, the first thing that we do is we'll invite the family and the patient into a consult room, and first and foremost we just want to hear your side of the story. So what the problem is, how did you come to see us, and what your concerns are. And at that stage we'll review the medical history from your regular veterinarian and do a physical examination of your pet, and from that point then we'll discuss with you what tests we think are necessary to find the answers to the questions that we need to answer. And typically what that will then involve is admission to hospital for a few hours, perhaps even the day, during which time we'll perform those necessary diagnostic tests. Most of our patients are sedated, and this is Rocco has been sedated, haven't you? Hey. So you can see that sedation for our patients means that they feel relaxed. He's happy to lay here. Rocco's a 4-month-old puppy, so this would, as affectionate as he is, would not be on his agenda if we didn't give him something to make him feel like a cuddle was just what he felt like. So we want all of our cardiac patients to be relaxed and not stressed. Then once we've done our diagnostic tests, we organise an appointment for you to come back in the afternoon where we'll sit down and go through all of the results and answer any questions that you have. And at that time, that's our opportunity to talk to you not just about the diagnosis, but also about what sort of lifestyle, dietary changes, medication, monitoring, all of the things that necessarily stem from understanding and giving your pet their best life in the face of heart disease. At Veterinary Specialist Services, together with the veterinary cardiologists here, we provide the only hospital-based interventional cardiology service in Australia that's multi-cardiologist. And so we have patients referred from interstate, overseas, in the South Pacific region, New Zealand, for cardiac interventional procedures. And these procedures are essentially the correction of birth defects using non-surgical techniques. So placements of stents, devices to seal up birth defects, balloon procedures to alleviate valves which may have been deformed at birth, and those procedures are all done via catheter techniques without the requirement for an open-chested procedure that historically would have been done. And so all of these procedures are very comparable to what's done in human medicine. As cardiologists in veterinary medicine, we've all had training in the human hospital situation, observing and participating in these procedures collaboratively on people and children. So the procedures are all the same, different range of defects, but the correction of them is the same, and they're all offered here at Veterinary Specialist Services. The other aspect of veterinary cardiology at Veterinary Specialist Services is our intensive care facility. So the pet intensive care unit is where our patients are hospitalised, if needs be, for urgent cardiac patients or patients that are requiring intensive and critical care. And that's a 24-hour facility which is run here at Veterinary Specialist Services, and at any time of the day or night, if a patient comes in of ours, they can be admitted to intensive care, and the emergency and critical care veterinarians who are on staff at that particular point in time have access to all of the medical records of patients who've been seen by the cardiology service, and they're also able to liaise with us directly after hours in order to make sure that a patient's care is optimised any hour of the day. So your expectations of the cardiology service and the consultation with a cardiologist are that you should leave feeling a real sense of peace, knowing that while the answers that you receive may not be the answers that you were hoping for, they are answers, and there won't be ambiguity about what the problem is with your pet and what your expectations are as far as what the future can hold. And we'll make sure that we equip you with the skills to make sure that you're giving your pet their best life. So if you'd like any information about the cardiology service at Veterinary Specialist Services, if your veterinarian has concerns about what they hear with their stethoscope, it's never too soon to be seen by a cardiologist, and you can contact Veterinary Specialist Services to arrange an appointment or speak to your regular veterinarian about a referral.